Welcome to Step Into Your Life with Julianne Williams. I have a topic today that is of utmost importance to those of us in the United States who have loved ones, or even for ourselves, that need to consider what happens as we get older. As you know, I spent over 30 years, a long time, in the long-term care profession in the nursing home and assisted living space because I have a passion for taking care of the elderly and infirm. But it's not an easy choice for so many families when it's time for long-term care to come into play. And so we have an expert today who is going to share with you some really good tips and some really wonderful information so that this time of your life or your loved one's life can be as smooth as possible in terms of transition. So today I welcome Linda Ryan, and she is an expert and a financial planner who can teach us how to deal with and approach the need for long-term care. So Linda, thank you for joining me today and talking about this really important topic. Let me first start by having you tell us a little bit about yourself.
Thank you, Julianne. It's great to be with you. Well, I am a mother and a grandmother. I'm also a widow, and I have been very passionate about this subject as well, having experienced it firsthand.
Well, as I talked about, this is a topic that we don't really want to discuss until we have to, and then we're ill prepared to put forth the solutions that are needed in a time where we might have a more level head in making the decision.
Right.
So I know that you want more people to learn about long-term care. Why do you think that people have an immediate negative reaction to those words, long-term care?
I agree. Most people that you bring up this subject, it's kind of like they want to put their hands in their ears. And I think it's because when most people hear that term, long-term care, they think of a location like a nursing home, and they don't want to have anything to do with it. But I like to explain and educate people that long-term care is not a location. It's an event. It happens when someone can no longer take care of themselves.
And, I find that a very interesting perspective. Like I said, because of my background
Right.
in the nursing home and assisted living space, and being very proud of the services that we provided to people, and knowing that there are so many loving men and women that devote their lives to caregiving in that sector. And so for me, it's not negative. I know that most people would choose something different if they could.
Yes.
And I think they should if they can. But there are so many wonderful people that devote their entire career to taking care of the elderly. So thinking about the fact that it's not necessarily a nursing home or assisted living facility center, why do you think people should plan for it?
Well, isn't it interesting, Julianne, that we plan for weddings, we plan for college education, vacations, we even plan for our retirement, but we don't plan for how and where we want to be cared for. Just thinking about long-term care doesn't mean that you have to go into a facility. It's wonderful that we have so many facilities, but nowadays, long-term care can also provide for in-home health care.
Yes, and it's changed so much. When I look back as a child, many people know that my hero is my great grandma, Surma Nahigian. She came over during the Armenian genocide, and she spent her last days in a nursing home in the Fresno area. And that's what catapulted my choice of career, because my grandma and my aunt would complain about the things that happened on a daily basis. And so I wanted to make it better. And so like you said, and so the whole landscape has changed. I look at the nursing homes now. When my great grandma was in the nursing home, it was a lot of grandmas and grandpas. And when I started, in 1990 and 1991 in the space, it was a lot of grandmas and grandpas in the nursing home. And now we see those folks in the assisted living, and nursing homes are really almost like med surge floors, many sections of them. And then they do have a long-term care component for those who need 24-hour care, but it's really changed. And so to your point, planning for it doesn't mean you're going to access it,
Right.
but it makes sure that you're ready to if you need to. So, I just sort of gave a little thing about what long-term care, how it is and what's changed. And we've talked about why you should plan for it, but the cost is what I think is what people get very concerned about, because they don't know how to get to the cost issue. So, is it expensive, or are there ways to pay for it that people should be aware of?
Yes. In answer to your first question, it is expensive. But let's say that you're paying a premium of $6,000 a year. Now, that's not cheap, but
Mm-mm.
what if you have to pay that every month? That's $72,000 a year. So that's really where, if you start planning for it, you may be using your 401k to make those payments, but you're planning for it. The other thing I want to say is, just like the automobile industry brings out a new model every year, insurance companies have adjusted also, and they bring out new products almost every year, different companies. So a lot of them have what is called a hybrid policy. When
Mm-hmm.
long-term policies were first introduced, we called them standalone policies because they could only be used for long-term care. But nowadays, with something called the hybrid or a linked policy, someone can use a policy to pay for either long-term care or a death benefit. So since we know that 100% of us are going to die, if we don't need long-term care, we have the death benefit. But if we do need long-term care, it's there. And that's what makes the policies very affordable. You can get a policy for a 30-something-year-old for less than $200 a month. That's pretty affordable.
Well, and and so that's essentially your life insurance as well.
Yes.
Got
Yes.
it. Got it. I like that. And so you just mentioned, 30-year-olds. So, what about Gen Xers? What about planning in that phase? I mean, is that too young, or, because you'll be paying premiums, or is there some benefit to all of us to start thinking a little bit about how we can handle our next stop? And I say that with a little grimace, although it's really more about life moving so fast. That's just another chapter that we get to experience, but I just don't want to get there yet.
That's right. I get that. So, in answer to the age question, the sweet spot to buy these long-term care policies are really in your 40s and 50s. For one, your age does contribute to the amount of your premium, but also by the time you're in your 60s and 70s, you might have some kind of medical issue that has come up. So that's why I say the sweet spot is at 40s and 50s. And it's interesting that I have talked to many people who they make some assumptions about long-term care. One of them is, it's never going to happen to me. I'm not going into a nursing home. Another one is, our kids will take care of us. And the other one is, well, the government will help, right? So I have pushback for every single one of those. For one, with the kids taking care, first of all, I'd ask, did you ask your kids? Is it okay with you if they wipe your butt when it comes to that point? And the other thing is, with the adult children, and this, we're already seeing that today, these adult children are already taking care of their children.
Mm-hmm.
So to take on the burden, if you will, of taking care of an older parent, I call them the sandwich generation. They're being stretched both ways.
It's true. And especially as we have children a little older than in the past.
Right.
Before, at this age where I am right now, my kids would have been raised, and instead, I still have college age kids. And I think some people even have, younger children. But let's talk about the government for a minute. I know that when, my time in the nursing home profession, there was a lot of confusion with everyone about Medicare and Medicaid. And if you're in California, it's Medi-Cal. But there was a lot of confusion about how that worked, when they could access it, and how they could qualify. So can you tell us a little bit about how getting prepared is also understanding Medicare and Medicaid?
Yes. And I'll add the third one. I just talked to a woman the other day who said, why doesn't my health insurance take care of this? Well,
True.
it doesn't, so we can't depend on our health insurance to pay for this. With Medicare, the way it works is if you need long-term care, you have to go into a hospital for a minimum of 3 days, and then the doctor transfers you to a long-term care facility, generally with skilled nursing.
Yeah. And let me add that it's 3 midnights too. So
Thank
if
you.
you go in on, Thursday at 10 a.m. and you don't stay Thursday night, Friday night, Saturday night, you may not qualify for Medicare Part A. They may want to send you out on Saturday morning, and you'll think you hit 3 days, but you may not have.
Right. Good point.
And that's the nursing home girl in me.
Thank you. Yes. And that's what people need to really get educated about, so they know the pits and the all those. But the thing about Medicare is it only pays 100% for like the first 19 or 20 days. After that, they pay 80% up to day 100. So even if you are in an assisted care or rehabilitation or any kind of facility like that for long-term care, Medicare is only going to cover it up until 100 days. Now, the other option from the government is Medicaid. And what that means is you have to actually have a very minimum amount of income coming in to qualify. And it's about $2,500, at least in my state. So that means, let's say you have 2 cars, you have a nice house, you have maybe you have some Medicare or Social Security coming in as income. Well, Medicaid says if you have 2 cars and there's 2 people there, you have to sell one of those cars. You can only have $2,500 coming in to qualify. What if your Social Security is $3,000 a month? That extra 500 goes directly to pay for your care. So that's why it's called spend down. And my parents actually went through it. So even though they had some assets, they had to get rid of them or sell them. And that's why my sister and I never had any kind of inheritance, because they had to go through spend down.
And to your point, the preparation is what's important. And when it comes to Medicare, you also mentioned, and it's true. So Medicare pays 100% of the first 20 days, and on day 21 to 100, they only pay 80%. And there are lots of strategies I know that you probably use to help people with that. But the other thing I want to mention is that you're not guaranteed 100 days.
Right.
It has to do with your clinical condition. So, for instance, if I go in and on day 37 of my stay in the skilled nursing facility or the rehabilitation facility, I am now medically stable, I don't get the rest of the 63 days. And so that seems to be a point of confusion for people as well. And I just like to point that out because I've experienced it with my parents even. So I think it's just so complicated. And I like how you're kind of breaking it down in terms of how do you qualify for Medicare, to activate your benefits? What are the things that are out there in terms of qualifying for Medicaid? And to your point, there's differences in every state, but the process and the principles are the same. It essentially, you have to become indigent.
Yes.
And then, and so then when you think of that, you know, should we be counting on the government to step in when we need that care? Because it's so complicated, and you can see that the benefits aren't totally comprehensive.
Right. The other thing I like to point out is I personally believe that we as a nation are just beginning to experience the fallout from not having proper planning. Because right now, a lot of people, especially in the lower income, are taking advantage as they can with Medicaid. But how sustainable is this? Because right now, I'm on the baby boomer generation. Did you know that as of today, not a single baby boomer has turned age 80? So that means that there is an incoming flux of people that are going to be needing long-term care that will be taking advantage of the Medicaid program. Will our children be able to have access to it? I don't know.
And that's such a good point. I don't know if you want to talk for a minute. I always like to kind of go to, and I go back to earlier in our conversation about, that stigma of long-term care, because it's a part of our life. I know none of us are looking forward to if we need that care, because it means we're sick. And
Right.
I've seen thousands of people in that situation. But I think back to the preparation, there are ways that you can think about what you want and planning ahead. And I mentioned it in another one of my episodes that I had with an expert on case management. And that is, do you know where you want to go? And is it important? Because, for instance, if you have long-term care insurance, or you have Medicare, or you have a Medicare Advantage plan, do you know where you can go prior to having the need? And so when you're working with your clients to help them prepare financially, I like to help people prepare emotionally
Yeah.
as well. And I know you are too. But do you recommend that people go and look at nursing facilities, assisted living facilities, getting to know home health agencies, hospice agencies, so that their choice is set? Do you have a plan for that with them?
Actually, I do. I am familiar. I live outside the Cincinnati area, and I am familiar with a couple of companies, one national, one local, that actually help families when they're trying to make that decision. They will they'll ask, what are your needs? What are your likes and your dislikes? Do you need to be in a close proximity to family? They ask them all these background questions, and then they make suggestions, and will even take them to some of these locations and show them off, help them make a good decision.
And that I I've coached many people because I have been the long-term care girl in my community and in my family and whatnot. And so I think that's a great idea, is to enlist the help of an expert. The
Yeah.
other thing that you can do at home, if you're interested, is you can just get on the internet, and Medicare has a rating system. And now I do want to caution people that there are some nursing facilities that have ratings that I believe are lower than they deserve. And that has to do with the inspection process. It has to do with acuity that they take, because if you take really sick patients, you may have lower stars because the complex needs, and that's kind of how it's rated, are difficult to meet. And because of that, the current regulations don't support what we have to do. But that's a great place to start, where you can find at least what is in your community. If you aren't in a place where you want to talk with somebody about it. And, you can always go take a tour
Yes.
and see what it's like in there. You'll see a lot more life and happiness than you probably will expect. And
Yes.
that's why I really like people to go tour, because some of it'll take out some of that fear.
Yes. I like what I think it was Nelson Mandela said, that education is the best tool to change the world. So if you want to change your world, get some education about this. Because I also like Abraham Lincoln said that the best way to predict your future is to create it.
Yes, yes, and knowing, especially in a decision that is as important as your health care.
Right.
So, and I want to talk a little bit about how to choose a nursing home real quick. I like to give these tips every time I have the opportunity, because people always ask me. And, you know, so I really like to kind of remind with some of the things that maybe you might want to look for. So, first of all, um, I think that you should consider location. You know, because you want to be able to easily see your family. And I think you mentioned that. But also, while location is important, I think, nursing homes do have certain specialties, and people may not be aware of that. So if you have a loved one or yourself with dementia, you want to make sure that you are with a nursing facility that specializes in dementia care.
Yes.
If you have had a cardiac event or a stroke, you want to find that nursing home that has a rehab team that is very familiar with what you need to recover.
Yes.
When you go and visit the facility, ask them about their Medicare and Medicaid certification, because not everybody has that.
Right.
And then in your case, like when we're buying products that will help us choose and have, that's what for me, and I do have insurance because I want to have a choice. I want options when I need long-term care, and whatever that is, whether it be home health, whether that be assisted living, whether that be nursing home, whether that be hospice. I want to have a choice. So
Right.
it expands your choice when you look at products that you actually work with, correct?
Correct. I don't think there's a single long-term care policy that's identical to another one. I work with several companies, and they're all different. There's one company, for example, that I work with that you can receive your long-term care benefits even if you're overseas. I work with a company that just came out this summer with a policy that covers not just one, but two people. And imagine this, they don't even have to be husband and wife.
Oh,
It could
wow.
be, it could be a mother and daughter. It could be a brother and sister. So there's lots of different new policies that are coming out that are reacting and responding to our needs, because times are changing.
I know so many people are retiring out of the country. So that is something I think is really helpful. And,
Right.
when you go and visit, look at the residents. We call them residents in the nursing home space. Are they well cared for? I always look at, are their faces washed? Are their fingernails clean? And that is a big signal to me. Now, the other thing I want to point out is residents also have the choice as to what grooming they would like, just like at home. So for instance, if you don't want to get up until noon and take a shower, you may see some people who aren't ready yet for that part of their day. And so you have to remember that the self-determination still applies. And that's a wonderful thing that people, I think, may not know, that when we think of the nursing home, we think of becoming a part of an institution. The other thing is, I always like to look and see, how do the nurses, housekeepers, the nutrition staff, the activity staff, social, how do they interact?
Right.
Not only with the residents, but with one another. And so you want to really look to see that they're engaged, and you can tell when people care. There's a feeling about it. So, And so the other thing is that, odors always come up. And I want to remind everyone that we all have physical needs, mostly in the morning. And so sometimes if you visit early in the day, there might be a transient odor. If there's still an odor at 4 in the afternoon, I would be very concerned. But if
Mm,
there's an odor in the morning, it might be that you have 55 people who have used the bathroom. And
right.
we all know how one person in our house sometimes can upset the apple cart. So just think of those things.
That's
Um,
right.
right? And then
That's
also,
excellent.
if it smells really, really good, just make sure they're not covering up the smells and the odors.
Yes.
And then if you made an appointment to visit, you might want to stop by a second time without an appointment and see if you see something different.
Right.
But those are, I mean, and those are really, really general, things. But you can see, like, look at the activities calendar and see how many things are offered for leisure. Ask them, do you have to eat in a dining room, or can you eat in your room if you want?
Right.
Those are all things that you can go in and ask. And I think it makes that whole process easier. And after, you've looked at all of the financial options, because, I know people don't want to talk about the things we're talking about, the financial piece of healthcare, but it's really important. Then once you know what you want, it makes it so much easier to think about that financial portion,
That's
because, right?
right. Yeah, that's why I recommend that planning. Uh, there's no way you can plan too early,
Right.
but there is a possibility you can start the planning too late.
Yes. And even in my family, we've been guilty of that. Those of us, I mean, we're in the profession, and we were, and it's, just really important, because that time can be very traumatic for
Yeah,
the whole family.
right.
Yeah.
I liken it to having to make emotional decisions after the death of a loved one. You're really
Yes.
not in a good place to do that.
Yes. So I am very pleased, and I am so grateful that you have become an expert in this. And I know you did it because of your own personal circumstances, that you learned that there could be an easier way in the face of having to make difficult choices. And so I thank you for doing that. It's really important. And for now changing, moving your career and your mission into this kind of work.
Yes.
And so, in my show, we talked about this. Everyone that comes on the show has a story. And a lot of what I like to do in my show is to talk about how we can make our life more joyful, how we can make our life more simple, how we can be prepared, like we're talking about today, so that when things come, that we can keep going in a way that brings us happiness. But I know that you have had some things in your life. We talked a little bit about our grief, um, and you've recovered, or I should say, recreated where you are. So, Linda, would you mind telling the audience what you have done to step into your life?
I'd be happy to. For this part of my life, I would say it probably started about 15 years or more ago when my father had a stroke. He and my mother were getting ready to celebrate their 60th wedding anniversary. And then dad had a stroke. He was in the hospital on their wedding anniversary. Now, he was able to come home, but he was never the same. He had to learn how to use a walker. And I can tell you, it was very difficult for my mother to care for him. If he fell out of bed in the middle of the night, she had to wait until morning so she could call somebody and lift him back up. So that was very personal, very sad to me, because we didn't know. We should have planned for this. And then a couple years later, my husband became disabled. He was disabled for 10 years, and I became his caregiver. And again, it was brought home to me, why hadn't we planned for this? There's a lot of stress on the caregiver as well.
Yes.
And I think I've made this my mission now to get the word out, because in my personal case, I had a heart attack almost 30 years ago. About 10 years ago, I was medically diagnosed with congestive heart failure. I'm now on my second pacemaker and defibrillator. So I am uninsurable. I talk about long-term care and I don't qualify. So that's why I want to get the word out to people to start thinking about it. As I like to say, you need to know it before you need it.
I like that. Thank you for sharing that, because it's hard sometimes for us to share those vulnerable parts of our heart and
Right.
why we do things. And I also believe that it's not always understood why we choose certain ways to make a living
Yes.
or to help people. And I think that you have been through so much, and I admire the way that you have taken that to help other people so that they don't end up, where you find yourself
Right.
and have found yourself. And so thank you for doing that.
Thank you for having me and helping me get this message out.
You're welcome. So I do want to give a moment. What if we want to find you? How do we find you? And I'll put links and whatnot, but can you verbally tell us how we can find you for advice?
Absolutely. I have a website and it's called thelindaryan.com. If you go on my website, you'll see my company, but you'll also see my cell phone. Feel free to use it.
Wow, that's a really kind offer, because not everybody gets one-to-one contact that quick. So
Yes.
thank you for that. And if you do have any questions about long-term care, whether that be home health, nursing homes, assisted livings, Linda is there for you, and you can contact her to get more information. And always you can reach out to my website, www.juliannewilliams.com, because that is something that is in my mission field as well. Though if it's financial, I'll probably send you over to Linda. So anyway, I appreciate your time today, and everyone who joined us. Thank you for joining us and letting us have this conversation that is so important to so many of us, not only for our parents or grandparents, but for ourselves. And so let's continue to learn about this life, and let's journey together.
Thank you, Julianne.